Thank you, Honorable Speaker. And Honorable Speaker, before I contribute, I want to congratulate my sister, Jerry, famously known as Gasheri Gaito, the Women Rep Kirinyaga County, for a well-thought amendment of this health.
What does that mean?
Gasheri Gaito is our Njeri, our small Njeri. Yes, so it's so it is to show that the Kirinyaga people and even the people who speak this language that I also speak like and admire her. We admire her leadership. She's courageous despite having a small body, but she's very, very courageous and at the same time very smart. Among the smartest women reps we have in our region and in Kenya. So congratulations, Honorable Jerry, for thinking about how we can be able to sort issues. And I always say, in this house, Mr. Speaker, we have solutions. Sometimes we look for solutions outside. Sometimes we'll go and complain to the people on what the government is not doing or what they ought to do. But we have a solution here. And I'm happy that this is, as she moved the motion, she said, it doesn't belong to any political divide. It belongs to every Kenyan. And Honorable Speaker, especially the members of this house, almost every day, every weekend, you get calls from the constituents asking for help. Mr. Speaker, I think I've written endless letters to hospitals, trying to beg CEOs, hospitals management to release dead bodies. Mr. Speaker, it is unfortunate that even having a constitution that is very clear on the right to life on Article 26, the human dignity on Article 28, the right to health on Article 43, and also emergency medical treatment, and even having the landmark ruling from High Court, the commercialization of health in Kenya is real. Honorable Speaker, last year I moved a motion that I had proposed that we, as the civil servants and also government officials, attend and to public health facilities so that, Mr. Speaker, as we are there, we'll also interact with our constituents. We will see a person who is coming in and being turned away. We will also give back the money that we receive from the exchequer through funding our insurances. And there's not a small amount of money going back to the public facilities. Because the challenge we have today is that we have more private facilities than public facilities. These private facilities are funded by the money from Kenyan citizens, whereas we have public facilities funded by the exchequer, but we will find that the services given there, we have a long way to go. Whereas we know, Mr. Speaker, a facility like Kenyatta National Hospital has the best doctors. They have even performed best surgeries, that have not been done in any other facility in Kenya. But you still find, Mr. Speaker, that you'll find there are not enough doctors. Patients going there, they will take a very long time to be taken care of. Emergency section, Mr. Speaker, we find that Kenyans are still taken back. Mr. Speaker, what do we talk, when we say about emergency, what do we mean? It is not something that was not planned. Maybe a fire, there was a fire and cases of fire. Maybe there was an accident, Mr. Speaker. When such a person rushes, the person is taken to the nearest health facility. So to go and ask such a person, give me 200,000, 100,000, where will they get it from? Honorable Njeri, when she was moving, she mentioned about my friend, the late Betty Bayo. Well, she went to a facility and they have to wait from 3 a.m. to 6 a.m. for people to wake up so that they can be able to give the money for deposit for her to be admitted. And she was bleeding. It is sad we lost Betty Bayo, a very famous musician. But this is only one of the cases that were highlighted. Many people lose their lives when they are turned away. And I think it is important that any health facility, even before we pass this bill, that when somebody comes in an emergency case, first save a life, then you can refer them to another facility if you see they don't have money. But you cannot just turn somebody away. That is even, somebody who is not even human, Mr. Speaker. And so we need to turn the eye from the health sector, from commercialization, to health that saves life and taking care of human beings. Mr. Speaker, when I was looking at the numbers of the body that were detained, I saw in 2024 Kenyatta National Hospital, there were 246 bodies of infants. I put myself in the shoes of a mother who walks in, waiting to go home with a baby. And maybe this baby passes on. On a small baby gets sick, you go to hospital and the baby passes on. Already the mother has the loss of that infant. And then you dare hold such a body because you want money from that mother. How inhuman can anybody be, Mr. Speaker? As we have said, a dead body has no value. Most of these families, and I know my colleagues have said there are other ways of finding out whether the family can be able to afford, or even giving, dates and times on when they can be able to come and pay. So the first problem, somebody came in or brought a relative, and then the person passes on. So it's already painful, the family is going through a loss. Very few Kenyans, even religiously, there's some religion that they want to bury their kin immediately. But if they are not able to get that body out, it will not just because they want to run away from paying. It can't be, Mr. Speaker. It is because they do not have. A hospital and a facility like the Moi Teaching Referral Hospital has a very clear, and I want just to say, when I was the chair of health, we visited these facilities. The Moi Teaching and Referral Hospital has a very good social support. And so the social worker, by the time you walk in the hospital, by the time you even get admission, the social worker is able to tell that family at the end of the day they will manage to pay or they will not manage to pay. Here we are talking about dead bodies being detained. But Mr. Speaker, even people who get well, a mother delivers, then you are detained in a hospital, you have to share a bed, or you have to sleep on the floor, because that hospital wants you to pay. No one would want to stay in a hospital even after one day when you are discharged, Mr. Speaker. So even as we do this amendment, we need to look at the law again and see how do we then make sure, and especially the social department of the hospital, such that by the time a person is being released from hospital, if a person dies, the hospital already knows this family is needy. We cannot be able to push them further. Let them first go bury their kin, and they can commit themselves that when we get this amount of money, we can come and pay. If it's emergency, once life is lost, it is lost. But if you save a life, you can be able to give that person a chance to go back, maybe recover, go back to work, take a loan, or even get money, do a harambe, and bring back. So I wish to urge, even as we pass the law, because laws are passed, Mr. Speaker, but the implementation of law is another thing. So if there is already a high court ruling on the same, why are we still having bodies detained in hospitals? So we need to have a way of these hospitals having to release these bodies so that the kin or the families can go and bury, and then they can be left with a clear way on how they can be able to sort the bill. Mr. Speaker, let me speak about SHA, because SHA has a component of emergency. And Mr. Speaker, if the SHA had covered only level 6, emergency happens and one is taken to the nearest facility. So we may need to relook, and I know the health committee members, some of them are here, if there is a way we can be able to look at what level is this emergency care being given at, so that even if you are rushed to the nearest dispensary, you are taken care of. If it's a level 1, level 2, level 3, because emergency is for somebody to be taken care of. Mr. Speaker, and I want just addition of one more minute, I want to say something about also emergency handling, because that is something that we also need to look as a nation. If somebody gets an accident today on Thika Superhighway, where do they get an ambulance?
One more minute.
Thank you, Mr. Speaker. Where do they get an ambulance? So we should be having a shortcut, like the way I know if I want to apply for Nyota, I'll do *54#. So if there is an emergency that happens on whichever highway, Nakuru Highway, then how can those people access to emergency care so that there's an ambulance? Number 2, handling of our patients. The majority of Kenyans are. Thank you, Mr. Speaker. Majority of Kenyans are dying because once they get an accident, you find people with pangas trying to cut the cars, trying to pull people out. So they actually don't die because of the accident, but the handling. So once we have that number of emergency, we also need to have professionally trained people so that if there's an accident, it's not the business of the people who come to steal phones, to come and try to pull people away. So you pull somebody, you cut off the leg and leave it in the car. So that if there's an emergency and there's an ambulance, the people who are well-trained personnel can come and handle the accident victims and take them to the nearest facility. I thank you, Mr. Speaker. I want to congratulate Honorable Njeri, and I support the amendment. Thank you very much.
The Honorable KJ.
Mr. Speaker, I must thank you and also wish you a happy new year and great leadership in this new session, as you always do by guiding this parliament with your very great leadership skills. Mr. Speaker, I also take this opportunity to congratulate and thank the county MP for Kirinyaga for coming up with this very crucial bill that is extremely timely at a time when country is considering its healthcare and healthcare legislation. I want to thank Honorable Njeri Maina, who is also in a way my county MP, let me say my in-laws county MP, and must thank her for such amazing legislative work in the House, and this is what Honorable Njeri, you are elected to do in this House. Mr. Speaker, this amendment is seeking to amend the Health Act Cap 241 of the laws of Kenya so that it is able to provide for